So this week, the White House shared President Trump was diagnosed with chronic venous insufficiency. That's why you're looking at his ankles here. A lot of people had been talking about they looked swollen. This came after a medical exam. So what is it? Maybe you don't know, and maybe you need to know if it's impacting you or someone you love. So that's why we're bringing in 9 News medical expert, Dr. Payal Kohli. Tell us what this is. They're saying common, yet most of us are like, is it pronounced venous? So
that was me earlier.
Very, very common. So after the age of 50, about 40% of people have it. A little more common in women than in men. Women tend to present earlier because there's some hormonal influences that change the way that our veins get leakier.
Of course.
The pregnancies we carry can affect it. Birth control pills and hormone replacement therapy can make us have venous insufficiency. Men tend to present later in life, and they tend to present in a later stage. So when we see it in men, it's usually linked more to obesity or being sedentary, and we see it in a more advanced stage, and it's basically leakiness of the veins in the legs. So the arteries carry blood away from the heart, the veins carry blood to the heart. They work against gravity all day long. So think about it, if you have a job where you're sitting all day, crossing your legs like I'm doing right now, or being sedentary or standing on your feet, the blood tends to pool and the valves get kind of lazy and leaky over time. So instead of coming back up to your heart, the blood sits in the legs and causes swelling and aching.
Is there anything I know that you said that this is common at this age, but is there anything to get ahead of it? Any symptoms to look for? I immediately think of some of my loved ones in their 70s and 80s. And especially people watching right now, what can they look at to see if they are in the beginning stages of this?
So I would say if you have a family history, then you could even do some preventive techniques, and we can talk about that in a second. But if you're later in life, over the age of 50, you notice any swelling in the legs, especially at the end of the day, especially when you travel, that gets better when
that oftentimes when you travel, that's a sign.
That happens, yeah. And then it gets better when you raise your feet. If you notice that your legs are aching, if you notice burning, itching of the legs or restless legs type of feeling. And then some people in more advanced stages will notice skin discoloration, a hyperpigmentation, a darkening of the skin. Any of those are abnormal findings and they need immediate workup. Of course, the swelling, as a physician, I first think of sort of the scary causes of swelling, which is congestive heart failure, liver failure, kidney failure, something in the pelvis like a mass or tumor compressing the veins. So you have to exclude all of that. But then if you get an ultrasound that shows that the blood is going backwards instead of going towards the heart like it's supposed to, that's how you make that diagnosis.
So, you think of compression socks. My dad wears them every day. A lot of people that have these problems do. If you were the doctor for someone that potentially has this, what tests would you want to see?
So I would want to see a whole host of blood tests to make sure, again, that this is not a kidney or liver problem. I would want to check a congestive heart failure marker, which I didn't see in the White House physician report, was actually reported out. It's called a BNP, that tells us if the heart is backing up. He did have an ultrasound, the president, which looked at his heart. It's called an echocardiogram that they said was normal. There was no signs of congestive heart failure. And they said the arteries weren't a problem. He didn't have a blood clot. So it seems like everything kind of looked normal. The only thing they found was these leaky veins. If you were to go have a test for leaky veins yourself, the technician or the sonographer may actually have you stand up, potentially even bear down, because sometimes the veins get leakier with those types of maneuvers while they're taking images.
I know.
That's interesting.
It is very interesting, but it does make sense. Really quickly, we have less than a minute, tips or best practices for just normal people?
So I think if you have genetic or family history of potentially having varicose veins or venous insufficiencies such as women tend to do, then you need to start practicing prevention in your 30s before the veins get leaky. And that means daily exercise. That means trying to elevate your legs whenever you're sitting at home. You're watching TV, you don't want them dangling down. Try to keep them at the level of the heart or potentially even higher to sort of rest those valves. Don't sit at a desk all day like you guys do. Get up and walk around because it pumps those leg pumps. And then if you start to notice any swelling, very early on, start wearing those compression socks to support your veins so that you're not putting more pressure on them. Because once they bulge out, it's really hard without procedures like vein ablations or sclerotherapy or cutting the veins out to fix anything.
Dr. Kohli, I feel like this is me.
Well,
I get restless leg syndrome. I have varicose veins, so am I.
And you carried some pregnancies.
Oh,
yeah.
okay.
So I want to see those compression socks on you, Sam.
They're really attractive.
Oh, great. One more thing for my husband.
Okay, thank you, Dr. Kohli. You can find much more with Dr. Kohli at 9news.com/Dr. Kohli.